agnosia as our poster presentation topic. The book gives a really good definition of agnosia. I just wanted to kind of sum it up. It basically is when a patient cannot recognize objects, sounds, or people, even though their senses work fine, and it's usually due to brain damage in the parietal lobes. It is a perceptual disorder, and it's really not very common. The prevalence of agnosia is actually unknown, but the Office of Rare Diseases of the National Institute of Health has agnosia listed as a rare disease, which means that less than 200,000 people in the U.S. are affected by it. I did find a really good book about the history of agnosia. It's called An Anatomy of Thought, The Origin and Machinery of the Mind by Ian Glenn. And it just gives more in depth than the book does. In 1878, a man by the name of Herman Monk reported a dog that had both parts of the occipital, or had parts of both of the occipital lobes in his brain removed. And he noticed that the dog could see, but whenever he was thirsty, he wouldn't drink his water, and if he was hungry, he wouldn't eat his food or recognize his food bowl unless he could smell it. Then in 1879, a guy by the name of Herman Wilbrand reported a woman that could see items in her cabinet, but she couldn't recognize them. She also could use a pencil if it was placed in her hand, but she didn't know what it was if you asked her, "What is this?" And then in 1888, Louis Very reported a woman who suffered damage in the lowest part of her occipital lobe, and she lost all sense of color, but just in the right half of her visual field. And then, of course, as the book tells us, in 1891, Sigmund Freud introduced the term agnosia, which explained all these weird happenings, and he said that it was to indicate the inability to recognize objects normally, despite normal working of the sense of organs and the nerves to the brain.
Me and Marcus are going to break down visual agnosia, and I'm going to begin by discussing aperceptive visual agnosia. And this is when patients cannot, they can see, but they do lack a higher level of perception, which in other words, they cannot visually recognize objects by their shape. The causes are head trauma, stroke, carbon monoxide poisoning, or Agnosia. And some of the symptoms of aperceptive visual agnosia are that they cannot recognize certain faces. They also lack the ability to distinguish familiar shapes and objects. And they also have a difficulty with copying just simple illustrations. There's no direct treatment for aperceptive visual agnosia because their brain lesions underlie the agnosia. But the intervention does focus on coping strategies for not only the patient, but the client's or the patient's family and friends as well. And the interventions usually take advantage of the client's ability to recognize the objects through their other senses, such as taste, feel, smell, touch. Patients with the loss of the ability to write, one of the intervention strategies that they use is visual tracing, and that this is when the patient practices tracing letters with their fingers as well as their eye movements in order to improve that ability. We also found a lady by the name of Donna Williams, and she is an individual that not only has visual agnosia, but she also has autism. And basically she just posts several of her experiences during her life coping with these disabilities and how her family handles them as well. And her mother even refers to her several times with the term blind-faced child. So she has several different blogs that are very helpful in kind of giving us more of a reflection of what an individual does deal with that we would never even think about the struggles that they do face.
Okay, and I did associative visual agnosia, and this is a variety of psychological tests that can be conducted to pinpoint the nature of the visual process that is disrupted in the individual. And brain damage that causes visual agnosia may be identified through imaging techniques that include computed tomography, scan, and magnetic resonance imaging. Some of the causes of this disorder, it is most often infraction of the posterior cerebral artery bilaterally. Other causes include tumor, hemorrhage, and demyelination, and is more common than apperceptive visual agnosia. Some of the symptoms are they develop due to the inability to retrieve information from those damaged areas that are associated with visual memory, may occur in association with other underlying disorders such as Alzheimer's disease or other diseases that result in progressive dementia. And some of the treatments for associative visual agnosia are people with agnosia, they learn certain exercises that help them identify certain objects that are a necessity for independence in order to identify necessary objects. People with agnosia learn to keep objects in a specific place, and it is suggested that people with agnosia use labels for objects of necessity. And right here is a photo of a man who mistakenly thinks this lock is a telephone. This is common with those who have associative visual agnosia.
Okay, I'm going to talk about auditory agnosia. When diagnosing this, the physicians first try to get rid of other potential causes. So this requires doing testings of the mental status and general cognitive abilities so they can exclude dementia and aphasia. The causes of auditory agnosia include damage to the subcortical region, to the temporal and the parietal lobe of either hemisphere. Some of the symptoms include auditory agnosis can understand spoken language, but they can't recognize environmental sounds. So they may misperceive sounds such as fire alarms, telephones, or bird chirping. I have an example of what this would be.
That sounds like a train.
That is what most auditory agnosia patients would think, that was an airplane sound, but they would think that it was a train sound. There's really no specific treatment for auditory agnosia, just seeing a speech or occupational therapist would help. I found an article, and it's about a 27-year-old female who showed auditory agnosia after having a severe hydrocephalus. She suffered from hearing loss in 1 year when she was 19, and she experienced severe difficulty in distinguishing between verbal, environmental, and musical sounds. I also found this heat map that shows what states experience more auditory agnosia, and Nevada is actually the state that you see it most.
All right. I had tactile agnosia as my different type of agnosia, and tactile agnosia is very rarely diagnosed because also it's assumed that the patients are aphasic or they may have dementia. So when diagnosing tactile agnosia, you really have to make sure that you exclude those things before you just pin it on agnosia. And also it's because not a lot of people recognize things just by the sense of touch. And so tactile agnosia generally is relevant to visually impaired patients. Some causes of tactile agnosia is that it's caused by damage to the somatosensory cortex, which is in the parietal lobe, which is the green part of the brain picture that we have up here. This is where the nerve signals from the sense of touch are normally received in the brain. The symptoms of tactile agnosia are that the patients just can't recognize objects or Braille letters just by the sense of touch. So without them looking at it or anything, they just can't recognize it just by touching it. And also for treatment, it's really rare that it's actually isolated as just tactile agnosia. So in treatment, you're really going to treat the underlying disorder that may have caused this damage to the brain. And also, people or patients with tactile agnosia benefit from physical therapy and occupational therapy just to manage their daily tasks. I did find a really cool journal article, a guy by the name of Joseph Gerstmann. He published it in May 2001, and it's actually about a 34-year-old infantryman who was shot in the head close to the the posterior part of the parietal lobe, and after he was unconscious for a few days, he woke up and he had weakness in his left hand, and they actually discovered it to be a really rare case of tactile agnosia that was actually just localized exclusively in his left hand. And so he just couldn't identify objects that he held in his left hand when his eyes were closed, but even though he could still identify the weight of it, he knew if it was heavy, he knew the texture of it, he just didn't know what the object was. So I just thought that was really cool that there actually was a case that was so rare that I could find. And a good way to think of tactile agnosia would be if you have one of those mystery boxes that you're putting your hand in and you just don't know what's in there. You can feel if it's slimy or if it's hard, but you have no idea what it is. I think that's a really good way to just think about how those patients feel. So that's what we have for agnosia. We just went over some different parts, and our references are down here at the bottom of the page. And we hope that you have a great summer break with your new baby boy.